It's important to know about your diagnosis of hypertrophic cardiomyopathy. For one thing, if you are having symptoms, that helps us as physicians know which medications to treat you with. And if you're not symptomatic, well, this just helps us know about this early on to make sure that you don't develop those symptoms or treat it if you get them, and also assess your risk of developing some of the other more adverse conditions of this disease. Hypertrophic cardiomyopathy is the most common cause of sudden cardiac death, especially in young athletes. The way we prevent that is by putting in something called a defibrillator that listens to the heart. And if your heart goes into that abnormal heart rhythm, to deliver a shock from the inside. Only a small percentage of people with this condition need a defibrillator, but there are certain things that we look for as cardiologists to know if you're at risk and need one or not. Half of your first-degree family members will also have this condition, so parents, siblings, children. And if we continue to extend that family tree, that's more and more people that could be potentially affected by this condition. And so knowing about that diagnosis and screening family members is so important because it helps us identify the condition early before they could potentially go on to develop a more severe form of this disease. This is what I would tell them. I've been diagnosed with a condition called hypertrophic cardiomyopathy, which is very treatable. And there is a 50% chance, because this is genetic, that you have it too. And so it's really important that you speak to your cardiologist and also get tested for this condition as well. I can certainly understand why somebody would be afraid to reach out for a diagnosis if their family member has this condition. It's human nature, but it's so important to get that diagnosis early just so we can treat this at an early stage before it could potentially go on to become something a lot more serious.